And thank you for joining us. We're back with Dr. Kressel of Phoenix CyberKnife, who we learned so much more about this morning. And he also brought with him one of his patients. I want you to meet William, a.k.a. Nick Broom. I want to thank you for coming in this morning, Nick.
Thank you.
This is really important because this is something that you're very passionate about, Nick. You've actually, you have prostate cancer.
Correct.
Your father had prostate cancer. You tried to tell him at one point about CyberKnife, and then you discover you have prostate cancer, and you went to CyberKnife. Tell me about your experience and what happened as a result of visiting CyberKnife.
Well, actually, CyberKnife was, to me, was the best choice I could have made. No downtime. Basically, it's 5 treatments of high doses radiation.
5 days in a row?
5 days in a row.
Okay.
And the staff is phenomenal. They basically, treat you like family. Mm. And so it was just a great experience for me. It had 0 downtime.
But at one point, Nick, weren't they telling you that you needed to have surgery? And you
Right.
actually needed to have your prostate removed?
Yeah, initially I didn't go to CyberKnife. I went, of course, to another doctor.
Mm-hmm.
And of course, the choices I had was either radiation, which is like 40-something treatments, or have it removed. My dad actually had it removed. His prostate cancer, he had it removed when he had it. And I talked to him about it, and he kind of talked about the side effects. And things that didn't appeal to me was, I just felt I was too young.
Right. And how old were you at that time?
At the time, I was 50.
Wow, that is young.
Yeah, so, and he had his removed, and you can be down for 6 to 8 weeks at a time in bed. And that's just something just wasn't appealing to me.
Well, not to mention the complications of surgery in general, 47 radiation treatments.
Right.
It sounds extremely laborious and painful. And Dr. Kressel, is Nick a typical patient that's coming to you with prostate cancer? I mean, he's had, first of all, tremendous success as a result.
In many ways, yes. Early stage prostate cancer, very good candidate for a number of treatments. Mm-hmm. I mean, those are options for him to choose from. And I think, the big message here was that he was able to go find out all of his treatment options, where initially he wasn't even, discussing or talking about CyberKnife.
Right.
So we had a chance to, provide him that type of opportunity to see what he wanted to choose for treatment.
Yeah, and I mean, can you imagine not having that as an option and surgery? I mean, just
right,
at your age, it sounds awful.
Well, the ironic thing was I didn't even know about CyberKnife. It wasn't even, no one ever told me about it, no one explained to me. I just happened to, go online. And I recommend anybody to do your homework before you decide to do anything and see what's out there. I mean, there's a lot of different options, and I just felt CyberKnife was for me.
Good for you. And tell me about how you're feeling today and what your diagnosis is today.
When I initially started, my PSA was a 7.7 when I actually went to Dr. Kressel here, and I'm down to a 1.6. So 3 years later, and it's decreasing. The goal is to get it down to 0, but 1.6 is still is a really good number for the time that I've actually been. I've hadn't had any side effects, didn't miss any work. My way of life has just been fantastic. And
you're doing normal activities
normal
and living a normal, healthy life?
Correct. Normal activity. A lot of things people are concerned about is ED when it comes to prostate, and didn't have any of those issues.
No problems, right?
No problems.
I'm happy to hear that. I am happy to hear that. And congratulations to you on taking control and charge of your health. And Dr. Kressel, thank you for coming on earlier and explaining all about CyberKnife and the opportunities that are available to other people out there. Thank you, Nick, for sharing your story. I want to give you some more information. If you have questions at all for Phoenix CyberKnife and Radiation Oncology Center, you can email them at info@pcroc.com. Let me tell you where they're located. They're at 4611 East Shea Boulevard. And I guarantee you they're going to answer those questions. Dr. Kressel was just on his phone, seriously, just a moment ago, actually chatting with someone. They are located in Phoenix. The number to call for more information or an appointment at 602-497-0605. You can always learn more at phoenixcyberknifecenter.com.